My name is Rick Grindrod, and I'm the CEO of Provider Partners Health Plan. Scott Rifkin is the CEO of Mid-Atlantic Healthcare, a long-term care and post-acute care management company. And Scott always believed that by improving the quality of clinical care in his facilities and doing what was best for his patients and residents, that was the right thing to do, and ultimately the payment structure would reward those people who were providing great clinical care. And so he hired me back in 2011 to work with him on some of the new alternative payment methodologies that were coming out of Medicare at that point, such as Medicare Advantage, the Accountable Care Organization program, and the bundled payment program. The Center for Medicare and Medicaid Innovation was created through the Affordable Care Act, and it sought to find innovative ways of achieving CMS's goals of improving access to care, improving the patient experience and quality of care, as well as improving the overall health of population, and thereby reducing the cost of care on a per capita basis. So with that, one of the first programs that we applied for was the Bundled Payment for Care Improvement program that was being rolled out. And Mid-Atlantic Healthcare was one of the very first post-acute healthcare companies that was an awardee in the Bundled Payment program. So the Provider Partners Health Plan model is an institutional special needs plan within the Medicare Advantage plan. And Medicare Advantage is a program where insurance companies offer beneficiaries coordinated care in addition to their Medicare benefits. Provider Partners Health Plan is a special needs plan specifically focused on the needs of long-term care residents who live in those long-term care facilities. And so we, as an insurance company, work hand in hand with the providers of that long-term care to offer our residents and our members a higher level of coordinated care while they're in that long-term care facility. National Post-Acute Healthcare, I'm the CEO of National Post-Acute Healthcare, and it is a bundled payment contracting and consulting company. We are also creating post-acute networks of high-quality facilities that seek to lower readmission rates back to hospitals. Provider Partners Health Plan is a Medicare Advantage plan that works with long-term care facilities to provide very specific coordinated care to residents of long-term care facilities. And then the third company is 5-Star Physician Services, and I am the CEO of that. And 5-Star is a company that provides physicians to long-term care facilities on an exclusive basis. I talked earlier about Scott's improving the clinical care that is offered to patients in post-acute and long-term care facilities, and he does that by engaging the clinical staff, nurses, by adding nurse practitioners to each of the buildings, as well as this dedicated group of physicians. All of those clinical providers need information to best serve and treat their patients. So Scott has implemented an electronic medical record at his facilities for each of his patients. That electronic medical record really is a repository of what has occurred with the patient in their healthcare experience. What our real-time medical systems does is it is a data mining program that on an hourly basis goes in and harvests the data from the electronic medical record and highlights for the high-level clinical providers what issues or problems may be occurring with that patient that have been noted in the documentation, but might not have been communicated verbally in any other way. So the data mining software highlights those issues for the nurse practitioner and the physician, so that they can treat any issues that might be flaring up much earlier in the process, so that they can deal with them, provide a new treatment plan, medication, etc., so that the issue can be dealt with and solved before it becomes a real acute issue, a real acute crisis that requires hospitalization. Healthcare reimbursement, particularly in Maryland, has changed from being volume-based to an overall reimbursement for a population or a subpopulation, a zip code, if you will, or a market area. And it really is aligning the healthcare financing with the goals that CMS has for improving the quality of the healthcare experience for the patient, improving the overall health of a population, and thereby reducing the per capita cost of taking care of a population of people. That alignment has created great opportunities for preventive care and care in lower cost environments such as post-acute facilities. So if a post-acute facility, through the use of enhanced clinical capabilities and technology, can prevent hospitalization, that really is very much aligned with the new payment methodology from Medicare in the state of Maryland. How does that impact businesses? I think that it really impacts Maryland businesses in two ways. Maryland businesses are impacted by increasing healthcare costs, particularly in Medicare. As healthcare costs go up, Medicare is going to have to figure out either how to fund those costs or reduce those costs. The funding mechanism would likely be by an increase to the Medicare tax to businesses, and so the more we can do to reduce the cost of Medicare and control the cost of Medicare, the less likelihood there is that a business would have to pay an increased Medicare tax somewhere down the road. The second thing that I think that impacts all businesses is that when a senior in particular, a mother or a father in their 80s or 90s, has an acute flare-up of a chronic disease and needs hospitalization, that requires, in my opinion anyway, the attention of the 40 or 50-year-old son or daughter, niece or nephew. And to the degree that that son or daughter, niece or nephew has to respond to that senior's healthcare crisis in the hospital, that takes them away from their responsibilities at work. And so I think you could definitely see an increase in the absentee rate of employees if we don't figure out ways to reduce the acute flare-ups of chronic disease in our population. So our goal is to empower and provide tools to the local clinical providers, physicians, nurse practitioners, and nurses, so that they can identify incidents of acute flare-ups of chronic disease. And we do that through a physician company like 5-Star that specifically is trained and experienced in post-acute care and long-term care. We train them in the tools of the electronic medical record and the real-time medical systems, so that they become not just neat technology toys, but real tools in identifying issues that need to be treated in the individual's healthcare situation. And all of that comes together with Provider Partners Health Plan, which as a Medicare Advantage plan provides for the Medicare benefits of that patient. And to the degree that through the care management programs of Provider Partners Health Plan, we can reduce the overall cost of care, because of 5-star and real-time medical systems reducing the incidence of hospitalization, then it's a win-win for everybody.